Hello, my name is Alex Beckman, and I'm here to talk to you about mental health prevention and early identification. I suffered from anxiety as a child, but never had it diagnosed or treated until it was at the panic stages in my early 20s. This issue is personally important to me because the ability to prevent mild anxiety from progressing further and identifying generalized anxiety disorder earlier would have saved me countless hours and thousands of dollars in treatment costs. According to the Substance Abuse and Mental Health Administration, depression rates among teens rose from 7.9% in 2006 to 14.4% in 2018. And according to the World Health Organization, in 2019, more than 301 million people worldwide suffered from anxiety, including more than 57 million children and adolescents. Like so many others with illness, we know that there are several factors that heighten the chances of a person developing a mental health disorder over time. Some of these factors are innate, such as the client's genetics, family history, or a biological neurochemical makeup. But other risk factors come from the environment, such as living in an abusive home or existing in a state of constant environmental stress. These modifiable risk factors can be targeted for intervention to prevent anxiety and depression from forming. And in individuals with many of these risk factors, the early stages of anxiety can be caught and then treated before the illness becomes severe. The impact of prevention and early identification of mental illness would have a large impact down the line of mental health care. Clients will be empowered to recognize the early signs of depression and anxiety and do what they could to limit the factors exacerbating those conditions. For example, if we could teach a broad range of adults that their persistent overthinking and lying awake at night worrying about the future isn't a natural part of life, it may spur some people to seek help who don't know that their thought processes are not an inherent part of the human condition. The impact on the clients would be immense, and the clients who caught their progressing anxiety or depression and prevented it would be able to foster healthier relationships with their families, raise healthier children, and be more productive at work, and have a higher overall health than before. When this person receives mental health treatment at a hospital, they may be so removed from the current reality that they are willing to hurt themselves. The staff then need to perform the dual role of keeping themselves and the client safe while the client calms down. On a larger scale, prevention and early treatment of mental illness can keep the public safe. While the vast majority of mentally ill persons do not commit violent crimes, a tiny fraction do. In 2021, a severely manic and violent schizophrenic man killed a woman at a New York ATM because he thought she was part of his manic command hallucinations. This man should have gotten treatment earlier, and if his schizophrenia was able to be controlled before it progressed, the entire incident might have never happened. As a general statement, medical care in the United States is expensive. The United States spends about 1/5 of our GDP on healthcare for a total of $4.1 trillion annually. And according to the CDC, chronic disease management makes up the largest portion of those $4 trillion. The cost of this management is so high because we're only reaching these clients when they already have the disease and need intensive care. It is a lot more expensive to treat someone with medications for COPD than it is to quit smoking earlier, or better yet, never start smoking in the first place. This same logic applies to chronic mental health conditions. Earlier, I mentioned how mental health issues tend to progress, and as they progress, they become more expensive to manage. In a monetary sense, it costs more money to staff a nurse and a CNA to do a one-on-one observation for a suicidal client than it is to see a mental health provider every other week and receive proper medication. The cost of avoiding early treatment is paid mostly by other people. If the client has private health insurance, then the increased cost of their care is paid by other insurance members in the form of higher premiums. If the client uses Medicare or Medicaid, then the cost is directly paid by the taxpayer in the form of a 1.45% income tax. This does not include the client's loss of future income while in treatment. When someone needs intensive mental health care, they are not able to work and have a loss of income, and thus may need even more publicly funded help when they are discharged. In 2019, the U.S. spent $225 billion on mental health services. Medicare and Medicaid paid for about 1/4 of all mental health and addiction services, rendering for a grand total of $56 billion. Yet, the total budget for the Substance and Abuse Mental Health Services Administration, a branch of the Department of Health and Human Services, is only $4.2 billion. Providing primary and secondary prevention services will not prevent the progression of all mental illnesses, but with so much money at stake, a small early investment could see a large downstream effect. If we doubled the SAMHSA budget and the cost saved Medicare just 10% on their mental health services, the taxpayer would save a total of $1 billion. Most of how we treat mental health in the United States comes from the form of laws and regulations. The first major law that directs the treatment of mental health patients is the Emergency Medical Treatment and Labor Act, which specifies that any patient has access to emergency medical services and will be seen and medically stabilized, regardless of their ability to pay. This law sets a minimum basic standard of care and is the main reason why the emergency room is the first place many severely mentally ill patients go for help. In decades past, mental health institutions had a reputation for involuntarily committing anyone the police or staff deemed as unfit. This slowly evolved over time with a series of Supreme Court decisions. The idea that a person must pose a threat to themselves or others was solidified in the Supreme Court case Lessard v. Schmidt, where a person could only be involuntarily committed if they posed imminent danger as evidenced by an overt act. Unfortunately, much of the interaction that emergency departments and hospital wards have with mental health patients is when they are so ill they require immediate treatment. The laws that would help change that fact deal mostly with funding. A current example of legislation trying to address the shortage of prevention and early detection of mental illness is the Mental Health Services for Students Act. This would increase funding so that schools would have a comprehensive mental health screening for adolescent students. We in the United States have all the funding necessary to provide basic education, screening, and medication services to those in need, but is a matter of political will. The budget and reimbursement rate for public health mental services is set by Congress, and these budgets can be adjusted to fit the public's need. I chose this topic because the benefit to cost ratio of funding mental health prevention and early detection would not only improve the lives of hundreds of thousands of Americans, but would ultimately lead to a reduction in overall public spending. I generally do not support an increase in taxes, but funding an increase in preventative measures seems to be the least expensive way to reduce the prevalence of a debilitating and expensive issue. In the short term, we as professional nurses can advocate for our patients to seek help when needed and educate them about mental health. If a client comes into the clinic, we can do a thorough assessment of their mental health risk factors. This would include asking about their social determinants of health that may play a role in increasing stress and susceptibility to anxiety and depression, then pointing them in the direction of resources that could help their immediate situation. If a single mother is constantly stressed about food insecurity, this stress will eventually lead to exhaustion and could develop into generalized anxiety disorder. Part of advocating for the prevention of this possible outcome is being an initial resource for services like the federal SNAP program or the Women and Infant Children program. When talking about longer-term strategies to address these systematic shortcomings of our mental health care system, we as professional nurses need to advocate for making mental health prevention and early detection a priority when it comes to the funding decisions at both the local and national government. First, this is voting for candidates who place the same values we do in mental health care. Second, this means getting involved at a level of government to advocate for change. This kind of involvement has been proven to work. In Washington County, Oregon, the Budget Committee just approved a $17 million project to build a Center for Addictions Triage and Treatment Center. Each year, the Budget Committee has their allotted amount of tax revenue for the budget. Where that money is spent is decided in the prioritization meetings. These meetings took input from local advocacy groups, and the plan for the Addiction Treatment Center had so much pressure from the mental health services community and the general public and lobbying groups that the funds were secured to start construction. One role of the professional nurse is to be involved in these lobbying groups and attend the committee meetings where the priorities are set to advocate for change. Nurses play a special role in this process because they are part of the mental health care system and can advocate for the professionals in that field. But they also have the most contact with patients and can advocate for their point of view as well. Nurses represent the best of both worlds when it comes to creating change in the way we as a society see and value mental health prevention and early detection.